effects of these medications: anti-anxiety, antidepressant, antipsychotic. It's very important for you to be guided by your own psychiatrist, if you have your own psychiatrist, because we really discourage self-medication. So others actually, like for example, they seek consultation once, twice, and then they just continue the medication, even if it may actually cause harm in the long run, or it actually affects them. It already affects their health, but because due to their hesitance or even ignorance regarding the effect of the medication or their condition, they just continue taking the medication, or they just stop it abruptly. There are a lot of conditions that need to be treated lifetime. There are conditions that needed to be treated like 6 to 10 months or 1 year. For example, schizophrenia. Usually, we treat them as much as possible, 2 years or a lifetime, because every time one experience relapse, there is brain loss. Okay? Why is it important that you have to seek the advice of your own doctor or psychiatrist? It's because there are a lot of side effects of the medication, and who knows, no, what is the normal side effect and what is the very life-threatening side effects of the medication. Usually for antidepressant or anti-anxiety, they can develop hypersomnia or sleepiness after taking the first week, or they can also experience lightheadedness, stomach discomfort, dry mouth, usually because the medication affects the muscarinic receptors, so they have decreased uh, increased dryness of the mouth, or at times constipation. Okay, so for the stomach discomfort, other symptoms can be it can increase your anxiety, or for depression, it can actually increase suicidal thoughts at the first few weeks of taking the medication. So it can make you panic, or it can give you a negative impact. Okay, and you stop the medication, but no. Usually the medication may take its effect by 2 to 4 weeks. And if it's not effective medication for you, usually your psychiatrist would change it after a month, or usually at the second week, no? Depende sa how your psychiatrist view the situation. So always be guided. So other symptoms or side effects of the medications are life-threatening. For example, for mood stabilizer, or for avoiding substance use disorder. Okay, for treating substance use disorder, we give oxcarbazepine. Others actually give carbamazepine. Okay, so carbamazepine and lamotrigine can cause Stevens-Johnson syndromes. Okay, this syndrome can start with rashes, and then it affects your body, okay, your system. Okay, so it's very important for you to ask the guide of your psychiatrist if you're taking this medication, because interaction with other medications can be very life-threatening. Okay, other conditions or effect of the medications is very, very detrimental to your health. Like for example, there is unstable blood pressure, heart rate, or having increased sweating, or even hyperthermia, or increased body temperature. So it's very life-threatening condition. Okay. Other conditions, for example, for antipsychotic, you can experience for aripiprazole, serious effect like akathisia, no? Like for example, restless yung feet mo. Okay, other than that, no, dystonia, there is problems already with the muscles, and it may be irreversible, okay? There are conditions like tardive dyskinesia, which is irreversible, no? As you can see with those who are taking antipsychotic, they experience the protrusion of the mouth, no, movement of the mouth, or of the tongue, okay? There are a lot of side effects of the medications, and if you take the medication without the guidance, you may experience the irreversible effect, okay? So it's very important for you to seek the help of your professionals. If you have a problem of follow-up consult every month, then you can negotiate with your psychiatrist if it's okay, if you're already stable, if it's every 2 months or every 3 months. So always remember, there are a lot of side effects of the medications, and you may like wait for it to decrease, or the medication should be shifted to other medications, or revise the treatment. Okay, so ask the help of your psychiatrist or any professional help. Okay, do not self-medicate, because it may affect you. Your condition may aggravate, or it may be worsen. And instead of curing or treating your condition, it may be another condition that you may develop, like independence with the medications. For example, benzodiazepines. It may give you instant relief, okay? Instant relief from panic attacks. Okay, you feel better. But then after taking it for weeks or months, you become more dependent to the medication, and you develop tolerance. So the effect of the medication of benzodiazepine, like bromazepam 1.5 milligrams, is okay for the first week, and then you need to take it twice to feel the same effect, no? It's tolerance. Okay, so you really have to ask for help, and not just Google your questions, okay? So you must be assessed first before you continue the treatment, okay? So always seek professional help, and do not just self-medicate, and then later on inform your psychiatrist that this is the medication given to me, something like that, and then what really happened is you self-medicated. So it's really very important for you to be honest as well, so we will know how to help you or to treat, okay? So always be informed, and don't be ignorant with the importance of the medication to you, especially if you have any mental health conditions. Okay, keep safe. God bless. I hope you learned from this video.